Good morning, Son Up on 7 family. It's Friday, and of course, it's an exciting day. Many things are happening today. One of the things that's happening countrywide is a campaign conducted by National AIDS Commission known as National HIV Testing Day. So today we're going to be finding out from Nurse Ortega, who's the M&E officer at the HIV program of the Ministry of Health and Wellness. What's the objective of National Testing Day? How can you participate? What services out there? And of course, what are new things happening within the HIV prevention program that will benefit Belizeans? As we know, Belize is heavily impacted by HIV. Every year, there's about 200 new diagnoses of HIV, and it's affecting a lot of young men between the ages of 16 to 24. So testing is a must because it can save lives. But let me leave it there and let's hear from Nurse Ortega herself, who's joining us via Zoom. Good morning, Nurse Ortega. How are you doing today?
Hi, Kevin. Good morning. How are you?
Good morning.
I'm doing fine. And you?
We're great. We're excited for this conversation. Thank you so much for taking the time to join us. You've been actively participating in HIV prevention, conducting these campaigns. So, what best person to hear about why they should participate in National HIV Testing Day than you, right? So let's get started with this conversation. Nurse Ortega, so the campaign is conducted countrywide. What is the purpose of the National HIV Testing Day?
Well, the main objective of the now National Testing Day, as you may know, it was in the previous years, we had celebrated it as Regional Testing Day. Mm-hmm. And which then we had our main objective of at least reaching 100,000 individuals within the Caribbean countries that were participating then for this commitment for Regional Testing Day, right? But the goals were reached, I believe, in 2017. So we Belize continue since then, and we rename it as National Testing Day. So again, our target is to scale up testing, to continue sensitize, as you may know, and many out there are a bit fearful or they still feel that perceived stigma, or they feel stigmatized. Or many times it's the real stigma. I mean, I have heard people wanting to get tested and they're like, but if I go, I don't want them feel that I am at risk. So we know there's many more things to do in order to, decrease the level of stigma that is attached to HIV testing. Hence, we want to continue promote. We want to encourage the people there, the population, the persons out there to know that HIV test is just a normal routine. It's just like a pap smear test. It's just like a glucose test. And it's not necessarily meaning that it's equivalent to a HIV diagnosis. But it's very important for the public to know that the reason why we are promoting point of care HIV rapid test is because we know that there are many individuals that might be at risk, that might have been infected, and they don't know their status because, as you may know, HIV infection is really in the few years asymptomatic. It doesn't show any symptoms until late in the years, and that's where we tend to lose that individual if appropriate care is not provided. And that's the main goal again, scale up HIV testing, have as much persons decide, I won't say coerced, but I would say to opt in to get tested based on their personal risks that they associate their behavior with.
Awesome.
Thank you so much for that. Nurse Ortega, I want to ask about in that same realm of having changed behavior. So in your recent, all of the outreach that you've been doing, talking to people over the years, do you see that after finding out about, being possibly HIV positive or, just getting a positive test, do you see changed behavior? Do you see people accessing services afterwards? I know there's counseling that is provided. Kevin has made great mention of that overall feeling of finding out and being able to be coached and counseled about that. Do you see that there's changed behavior that comes afterwards?
Yes. To my experience, working with persons living with HIV for the past 12 years, directly providing them with care, I have seen a lot of personal progress, yes, we can associate a lot of social factors that impact greatly on the behavioral change of that individual. And why I'm saying this, because many times the individual is well aware. He's aware, she's aware. They have the insight, they have the knowledge of what needs to be done and change, but it's difficult for them to turn that insight, that knowledge into an action, the behavioral change that we want them to do. But this is also linked to many factors that limit that to them. For example, if we have, I have had individuals who are actually alcoholics, that it was a bit difficult for them to just stop drink right away, the time that we want. Yes, maybe that individual was at the late stage of HIV with a low CD4, presenting with opportunistic infections, and the process that he goes through, the psychological impact of choosing between, okay, that we call it that moment of grieving, okay, and that moment of deciding, bargaining, should I continue my meds? What is my hopes? That outlook in life tend to be really, really weak at that point, because they continue to bargain. They have this issue with drinking, and yet they do have to deal with their health issues. This is just an example related to drugs and alcohol use. We have other individuals that, due to the financial constraints, single parents, single mothers, that's the only form of getting their income through what they're doing. And although it places them at risk, they will be very hesitant. Yes, they will try their best to protect themselves, to take their medications, to use condom. And even so, when we talk about a person who don't have any social barriers, I would say, but live in a discordant relationship, meaning the partner is either negative or she's the positive, or the husband is positive. So the zero discordant there. Sometimes they don't disclose, especially when it comes to females. I have had many encounters where the female is positive. Husband doesn't know, maybe he's infected, but she's afraid to share the status, right? And many times we will tend to lose that individual because she doesn't want to visit the health facilities, because part of our health services, especially when they're going through the prenatal care or accessing a pap smear, HIV is a routine testing being asked, and many of our persons tested are females. So many times we will capture the females who are HIV positive, but when it comes to disclosing, there's many risks to that. Intimate partner violence, domestic abuse, if they were already having hard to negotiate sex, no matter how much this female would want to protect her partner, and trying to use a condom, the first question that the husband or the partner might ask is, why are you using a condom with me? And all his assumptions will come on board, and the discussion, the issues that leads to domestic violence and even intimate partner violence.
Yeah.
So there's many factors to consider when it comes to behavioral change. And it's a one-to-one, it's a personal process that individual go through, and it goes in different stages.
Most definitely. I can't even imagine, thinking and finding out that information, how it impacts you mentally, and then now have to get the words to tell your partner and the people around you that, you've tested positive. That psychological, turmoil could be something hard on anybody. But it's really important that, there are partners, there are people that allow for the counseling to take place, the support to take place, that people can feel like, if I do this, I have people that I can lean on to as well in that process.
Definitely. That's one of the vital things about the HIV program of the Ministry of Health and its partners, that there's support services for people that get HIV positive diagnosis, and how they go about, living a healthy life, establishing a support system, because it's very important for persons living with HIV to have that support system. And events like National Testing Day also is very important for for people to just know their status, as Nurse Ortega is mentioning. Do a health check as much as you're doing your pap smear, checking your glucose. Stop by and do your HIV test. Right?
Exactly. Nurse Ortega, on that same note of like, knowing your status, how long does this test normally take? Because I always go into that idea of like people waiting for the result, the fear of like how long, the anxiety that can come with just getting your results, right? So like in general, how long does it take for someone to get their results? I know there's a process of, I think like 3 different tests you take after in some months.
All right.
So can you tell us about that?
Yeah, first of all, it's very, very important for the public to understand, though. And I have to mention this because I have been doing testing, and I'm sure Kevin has, and he has been asked these questions many times. Many times you will hear a person say, oh, I came to do AIDS test. There's no such test as AIDS test, AIDS test, right? Because remember, the HIV rapid test, which is a finger prick, is just a prick, a drop of blood that we use that will give you the result within 3 to 4 minutes, 3 to 5, the max you should get a result. What takes a bit of time though, which is very essential, is to inform the client or the patient who is accessing an HIV test that the HIV rapid test, it's a antibody HIV rapid test. What does that mean? That it will pick up antibodies or the antibodies against the HIV virus in the event that you have been exposed. But the rapid test, which is a 3rd generation that we are using, only picks up the antibodies when the individual exposed has completed at least 6 to 12 weeks after his last exposure risk, which means that if you had sexual intercourse a week ago and you think that individual or the person tell you he's positive, then if you go to do a rapid test, the rapid test we're using will not show right there and then, because our body our body takes time to actually produce the antibodies right away. But in order to build up enough for the rapid test that we are currently using, will take 6 weeks the least. So the importance of you knowing your risk, when was your last sexual encounter, and if there was any risk involved, is very vital for that person who will be receiving the result. Because the rapid test alone, like I said, it's 3 to 5 minutes. You'll get either a positive or a negative. But that negative doesn't mean that you're negative. Negative. It's based on your exposure and the timing of your exposure based on the rapid kit that we're using.
Right. And I just want to contribute that by an exposure, we mean coming in contact with any infected fluid, which can be blood, semen, vaginal fluid, or breast milk, because those are the only body fluids that can transmit HIV. And as you rightly mentioned, there's a window period of 6 or 12 weeks, which plays a crucial role in whether if a test is going to pick it up or not. Nevertheless, we encourage everybody to be doing an HIV test. At least every 3 to 6 months.
We're just going to ask, to
know what's your status. So we can definitely see the important role that national HIV testing day plays in people knowing their status and getting more information about what support system are there for HIV positive persons, for persons who stay negative. Nurse Ortega, so it's a national campaign. Can you share with us where these locations are going to be located and what are the services that are going to be available?
All right. Actually, all the district facilities, including San Pedro, will be having their health fairs in public spaces, the parks. I believe Orange Walk, Corozal will be at the Hor Gabriel Market. Belize City, I think it's, I'm not really certain about the places, but I know it's happening across the country. Otro Benque, Cayo is having it at the Benque. Yeah. San Pedro is having it today in front of the clinic.
Yes.
And Punta Gorda as well is having their health fair at the park area.
Okay. Yeah, and also we do have the flyer that has the different locations countrywide.
And I'm sure they can also check out the Ministry of Health and Wellness page.
It's in the NAC. It's in the National AIDS Commission, since this is actually an initiative of the NAC, and we are just collaborating with the testing.
Yeah. Nurse Ortega, we're talking about HIV prevention, and we mentioned that HIV testing plays a key role in preventing HIV because either you know your status as negative and then you continue with your practices to keep you negative, or if you're positive, then you access healthcare to reach to a point of being undetectable and prevent the transmission of the HIV virus. But a new thing that is in the scene right now for Belize and in the horizon of being rolled out is PrEP. Will there be any information about PrEP at these health fairs? And of course, can you just reiterate for our viewers what PrEP is and how effective it is in preventing HIV transmission?
Yes, part of the, as you know, Kevin, the Ministry of Health has made a lot of progress when it comes to HIV. I mean, I remember collecting, I remember as a nurse, doing HIV test through collection of a sample, then centrifuging that sample, separating the serum. And in a few years, the country managed to obtain the rapid tests. Currently, progress is being made when it comes to point of care testing, which is rapid testing for HIV. And we are moving away from the third generation rapid test to fourth generation. The difference is that this fourth generation rapid test will have now an antibody portion to it, antibody antigen, which means that we will be able to detect at a shorter period the status of the individual. It will no longer be within 6 to 12 weeks. It will be at a shorter timeline. That's one. We are the countries introducing Hep B, Hep C rapid test, and even the HIV syphilis combo, which means that with one finger prick you can have your syphilis and an HIV rapid test done on you. That's when it comes to prevention. That's part of it. We know the condoms, the lubes that is actually available. We might not have the flavored nor the colored ones, but we have the regular ones that the country usually provide. Adding in now to the HIV preventative packages, we have what we know as a component of post-exposure. I know, and I am well aware that maybe people might not know, but we, as part of the medical field, PEP, we had post-exposure prophylaxis, and that's where PrEP comes in. PrEP is pre-exposure. That means that you're able to determine when you're going to have your intimacy, your sexual intercourse. This is specifically for persons that could plan ahead, persons that are well aware of their risks, that they will be involved. So the PrEP comes very handy when you are able to determine your risks when it comes to HIV. And then the PrEP is literally using one of the antiretrovirals to prevent the acquisition of HIV, which means that there is some mechanism behind it. Either you take it, there's two modalities, either you take it daily or event-driven, meaning 2 to 24 hours before your sexual encounter and followed by another pill and another pill. So you are able to plan it. That's before your sexual exposure, before your, it can be sexual exposure, it can be other exposures. And that's in the other exposure component. That's where I want to kind of emphasize, because we have been hearing PrEP, but we also have NPEP. I'm not certain if you guys have heard about NPEP, non-occupational PEP, that comes hand in hand with PrEP.
Yes, of course. So as you already mentioned, so NPEP means occupational exposure. So for persons that did get exposed to HIV, let's say you had sex with somebody who was HIV positive and you did not know their status, or your condom breaks and you were having intercourse with somebody who was positive. Of course, if they're taking medication, then their viral load is reduced, which prevents the transmission. But for persons that are not like so adherent to their treatment, then that might be a problem. So persons can go to the clinic and access treatment for a month, which is the same antiretroviral treatment, and then that can help them to prevent becoming HIV positive.
Yeah, and that's very important, because we tend to think about NPEP only when it comes to persons that we know that know their HIV status. In this case, you are referring to discordant couples or discordant partners. But it's very important for the public to know that NPEP is also available even when it's consensual sex, meaning that you had agreed to have sex with this person, but hey, I think I'm at risk. And if you access the NPEP before the 72 hours, you can be provided treatment based on the exposure risk, right? There are certain levels of exposure that the clinician should be able to identify and provide you with the medication. Also, like you said, condom breakage or condom leakage, all of those things can be considered. And it's very important for the public out there to know that there is that service available, and is a matter of accessing through the health facilities. And PrEP is a bit distinct, though, a bit in the process of before your exposure, and that's where we have had a lot of, I would say, resistance in implementing it, as many persons are of the thought or think that we are promoting or fueling the HIV epidemic, and which we want to share with the public that is not the case. We just want to further prevent, as PrEP has proven to be very, very effective when it comes to the to decreasing the transmission of HIV.
Yes, Mr. Tega, thank you so much for giving us, a series of ways how HIV can be prevented and services that are available at the Ministry of Health, starting from counseling for behavior change, availability of condoms and lube, getting your HIV test. There's antiretroviral treatment for persons who are HIV positive to get to undetectable. There's NPEP now that you can get if you are exposed to HIV, which again, I have to reiterate that it has to be accessed within 72 hours after your exposure. If you wait longer, then the effectiveness of it decreases. And of course, PrEP that is going to be rolled out July 1st at the Ministry of Health and BFLA. So there's many ways how HIV can be prevented, and that's absolutely amazing. I mean, I miss working with you, Nurse Ortega. I really do, and I thank you so much for taking the invitation to give us this insight as to what's happening in the realm of HIV prevention, HIV services, and of course, National HIV Testing Day, which is happening countrywide at different locations. So we encourage our viewers to go by the nearest location in their municipality, visit the National AIDS Commission Facebook page for that locations, and access your HIV test. But there are also going to be other services like getting your glucose checked, blood pressure, nutritional advice, counseling support. So it's going to be a whole health fair out there.
It should be a thing where you take your friends and you just go and stop by. I really encourage anyone to be able to go out there, just know your status. It's super important. Don't feel afraid. There are going to be support systems there. Actually, you should be afraid of not knowing your status. I think that's much more of a fear builder than as compared to going to take the test. Right. It's very quick and simple.
Or the anxiety of not knowing.
Anxiety of not knowing, you never know. And so especially if you're out there engaging in unprotected sex, please be mindful of your actions and have that conversation, with the boots and with the people that are there, the medical professionals, and just find out, guys, what can be done to prevent, HIV and AIDS from being contracted. Get all the questions out. We just had a small amount of questions today, but go in and ask all the questions, access the services, and make sure you're taking care of yourself and your family. So with that, we just want to thank you again, Nurse Ortega, for taking the time out to have this meaningful conversation with us. Yeah,
thank you, Nurse Ortega. And all the best to all healthcare workers working today at the HIV testing campaign. We wish you all the best. It's Public Service Week, so why not give you thanks and also a big up to all public servants as well, doing great work out there.
Yes. They get a 10% back too. So this is even a more big up today, right?
Yes, yes.
And so with that, we go to our next commercial break. When we're back, we're going to be giving away a lot of stuff. So get your phone ready. We will be taking WhatsApp calls. So for the people I know some of the viewers may say, Renata, things hard out here. We don't got credit. So it's okay, honey. But we do WhatsApp and we do normal calls. But make sure you get your call in. And so stay tuned for the exciting giveaway section. You do not want to miss out.